Hello there, and welcome to Dry Eyed Girlfriend, the podcast where beauty, wellness, and science come together in the most eye-opening way. I'm Angela, your advocate, wellness enthusiast, and go-to girlfriend for all things dry eye. Sure, there's plenty of science and medical jargon out there, but where is the real talk? I created this show to raise awareness, share practical solutions, and bring you episodes with global experts, holistic health pros, industry insiders, and women just like you who are navigating the same journey. We talk about everything from nutrition and skincare to the most up-to-date science in dry eye. Because when we start connecting the dots between lifestyle and eye health, everything starts to get a whole lot clearer. Let's get into it. And welcome back to Dry Eyed Girlfriend. Thank you for tuning in. Today, I'm joined by Ashley Noonan. She's a psychotherapist, yoga instructor, and new mom that has spent the last few years navigating her own dry eye journey. Since 2020, Ashley has seen multiple specialists, educated herself deeply, and learned how to advocate for her health. This commitment has made her a trusted support for other patients online, especially those just starting to sort through diagnoses and treatment options. She's also co-hosting the Focus on Relief Dry Eye Support Canada annual event with Dr. Prosta this Thursday, December 11th, where they'll be guiding patients through treatment options and how to advocate for themselves. Ashley brings both a thoughtful blend of clinical understanding and lived experience, and I'm really excited for her to share her story today. So I'm so happy that we made this happen. I think this has been months and months in the making. When I started the dream of this podcast, you were my first guest in mind. So here we are.
Thank you.
Finally.
Yes, I'm so happy that we've
so happy. I'm rounding out this kind of first season with you at the end, and I couldn't be more beautiful. We talked a little bit about you, but if you wouldn't mind for the listeners, just walk us through who is Ashley?
Yeah, I guess. Okay, so I'll just talk about myself a bit.
Tonight.
I'm a new-ish mom. I have 11-month-old twin boys, and it's the best thing ever, even though it's really hard. And I'm also a dry eye patient. Diagnosed since 2020-ish, but definitely had symptoms way longer than that. Just didn't know what they were. Growing up, I played a lot of sports. I'm really into being athletic and doing hard things. And as I've gotten older, I've gotten into teaching yoga. And as a career, I've been a school teacher and a yoga instructor. And then recently I became a psychotherapist. And I love nature. I'm just a person that likes to have important conversations and feel connected in my life.
I love that. I had the absolute honor of listening to your podcast that you put out. What is it? Finally Free?
Yes. Land Softly, and then maybe Finally Free was one of the episodes or something. I don't even know because I haven't done it in so long. Yeah.
But it was beautiful because it gave me a bit of background on you. I had no idea how involved in sport you were.
Mm-hmm.
And you've definitely downplayed it. So you're athletic. And I think you are very much attached to this inner self that I think a lot of us need to explore. And I think through yoga and potentially your work too, as a psychotherapist, you have such a great insight, especially when I think of dry eye and how this particular disease can be very much a mental health type of journey as well, because it's an ebb and flow, right? And we can talk about your journey more. Starting in 2020, what that looked like, and just through even a mental health perspective, what you've gone through. When you first got diagnosed or first started recognizing, what were your dry eye symptoms? How were you connecting the dots? Because I feel like a lot of people are not making that connection, and that's so important.
Yeah, so when I first started having worse symptoms, okay, so for a while I was using Sustain eye drops just throughout the day when my eyes would get dry or after hot yoga, because hot yoga would make my eyes dry. And I never thought anything of it. I didn't even know dry eye was dry eye disease. I just felt my eyes are dry. I'm going to use these drops that help it temporarily. And then it kind of just started to become kind of a nuisance. I was noticing my eyes a lot more, feeling irritated by them. My main symptoms were burning, burning dry pain. And yeah, in 2020 at those times I was doing hot yoga almost every day. And I think I told you this in one of our private conversations that I would feel so tired to go to bed like really early, and I realized over time, oh, it's my eyes that feel tired. Like I feel like I can't keep my eyes open any longer. Like the drops aren't really helping. I just need my eyes to close, and then I would get some recovery and feel pretty decent in the morning at that time. And then I started to just do more research into 2021 because I was like, there has to be something else out there. Like, why is this happening to me? The drops aren't helping. So I started to dig a little more. That was when I started finding out like about the dry eye groups, and I started asking for referrals first to ophthalmologists and things like that, like taking next steps. And that was my symptoms were just increasingly getting worse. I did try some of the online things like put warm compresses on your eyes, and those often made me worse too. And then I was like, well, what am I supposed to do? Like, I've even tried the baby shampoo, which is like such an old recommendation now. Like, just no, don't do it. And I had a bad reaction to that as well, but probably because there's fragrance in it.
Yeah, and it's so harsh. No.
Yeah.
Shout out to that though, because you're not wrong. Recently I had a conversation and someone was like, "Oh, I just use baby shampoo." I'm like, "Please don't do that.
There's so many
Please
better
don't do
things
that."
now. There's so much more.
Oh yeah. In fact, like baby shampoo can really strip your biofilm and that
Hmm.
just creates so many more issues. So it's so harsh. No baby
Yeah.
shampoo.
I
Oh
know.
yay. Okay. I think it's helpful for people that understand like what your symptoms are so they can relate to that. I
Hmm.
think if you notice your eyes, that's a cue to go and see a dry eye specialist. And I
Hmm.
think, there not every doctor is versed in this, and you can probably speak to that too. But when you do find specialists that do understand, you can get the treatment that you need. And I think we're all unique in how we're going to respond to things, even in different aspects of our life. Hormonally, what's going on? We change so much, season by season, I call it. And I'm sure you've gone through that too. I'm going through, especially with the winter, such a change.
Hmm.
So anyway, yeah. But from your perspective,
Yeah, definitely. The diagnosis part was hard. So I saw an ophthalmologist who was just kind of really dismissive. Oh, like
mhm.
all you can do is warm compresses, like take omega 3s. Like you, this is a long term condition. And I got diagnosed with blepharitis at the time too. And I had much prettier eyelashes back then, but I would also use fake eyelashes sometimes, and I was having reactions to those. Like my eyelids would swell, and so that was when I got diagnosed with dry eye blepharitis. And like he also recommended the baby shampoo, but I was like, I already tried that from Google, and I'm not doing that again. And then I actually like tried to implement some of his things again because I was like, well, that's what the doctor said to do, and they still didn't help. So I went back to him, and I think he was just kind of like, oh, like you can't come see me for the same issue twice. Like there's nothing else I can do. So that's what led me to be like, okay, I've seen there's some optometrists that like call themselves dry eye disease specialists, and I had seen a regular optometrist who had like a little bit of dry eye experience. She had a red light and I think it was like a blue light mask, and also I did a couple IPLs with her when I first got diagnosed, not even really knowing what those were. I was like, yeah, I'll do your treatment, and then I decided to take a deep dive and find someone that was actually specialized. When he got upset with me for coming the second time for the same issue, I cried when I left because I was just like, it's not just like a cosmetic thing. It's like my eyes hurt all day. Like I can't function normally, especially in environments that don't have good air. That's another thing that's a big trigger for me. And schools don't have good air. Like most school environments don't have good humidity in the air, or even good, I would say, like dust free spaces. So yeah, I was feeling pretty anxious all the time, on top of like overwhelmed, and then also like worried about cosmetic stuff too, because like blepharitis, your eyelashes don't look that good. Just there's so many components, and you don't know where to turn other than I was looking on support groups and trying to figure out what my next steps were.
Yeah, and that's tough, right? I think I would say over the last few years, and correct me if I'm wrong with your journey as it stands now, there have been a lot more advancements around support and even doctors being trained and more excited about dry eye because I think there's a lot more treatment options than probably back in 2020 when you first noticed your symptoms. I know for me, when I first was diagnosed, it was really Restasis Sidra, a little bit of lid hygiene, and then Lipoflow at the time, which is basically an in-office procedure that works on warming the meibomian glands and then basically milking those glands. We talked about this at one point too. I don't know if you tried that too, but I feel like you've tried everything, everything from now IPL, red light, and then, that's, second doctor, now you're doing your research. What happens next?
Yeah. So I never tried LipiFlow, but I can go over all the things I have done after. But so my next steps were, I found a new doctor, and I would say that was the first time I felt like very validated and got like a thorough write up with like actually asked for the printouts of like what my diagnoses were and did more like in-depth research about, what my diagnoses were. So I felt just validated and supported, and like I had some type of direction.
Do you remember what that workup looked like?
Yeah, so they did like images of my eyeball, the corneal staining, to look at like if my eyes were fully stained. They like zoomed in and took pictures and changed the lighting to like see, I think, the vessels in my eyes too. Looked at my like tear breakup time to see how fast my tears evaporate from my eyes, and just very thorough. And then like my diagnoses were like MGD, ocular rosacea, potentially some aqueous deficiency, but that didn't seem to be a main thing, but everyone kind of has a bit. And then potentially some type of corneal nerve involvement, like because my symptoms were so high for like the level of dry eye I had.
We have very similar dry eye diagnosis then. Ocular rosacea, MGD. I don't think I have the pain piece, but I can definitely empathize. It's a lot, right? And it's kind of like figuring out now what's the root cause, right? And
Yeah,
then how to
totally.
treat that.
I think it's also hard when you have the ocular rosacea component, because a lot of people that don't have that can do a lot more heat and help the glands flow. But like with us, it's a really fine balance of like too much heat is going to flare rosacea and make you feel worse. But if you have clogged glands, you do have to technically do some type of heat probably. So like finding the like, it's like the secret sauce for what's going to work for you that won't worsen your pain, but also helps you manage like the progression of the disease.
Oh, yeah, for sure. And I know, like, in the research I've done, and I think you and I have talked about this, IPL is ideal for ocular rosacea because it takes care of,
Hmm.
cleaning it up on your face as well. But, too much of a
Yeah.
good thing can be too much of
No,
a good
yeah.
thing. I know for yourself, how much you want to share about your journey with IPL and where you're at with the next set of treatments, because you've done some cool treatments too that I
Yeah.
don't know if everyone's aware of.
I started with, I think it was initially four
Yeah.
IPLs, which were like spaced out for like, I think every few weeks was like that's like the regular treatment protocol. And then I think within the next year after that, I did like a handful more because my symptoms were just still pretty strong. I find IPL kind of painful because I'm just sensitive, and the higher settings are usually used on people that are a bit more fair, from what I understand. But it also made my skin look nice. It was like a nice side effect, and I did find it did help with inflammation, but it didn't really help my the pain in my eyeballs per se. So at that time, I was also trying. I started doing AST, so like the serum tears, like where they take your own blood and make it into eye drops, with mixed with the saline, like the plasma type of thing. And I was doing that 4 times a day for 6 months. I did it twice over the course of I think 2 years, like spread out, just to try to help potential corneal nerve regrowth. And at home, I was mostly doing cold compresses at this time, just because like I couldn't find anything heat based that actually helped me. Unfortunately, I'm one of the, I would say more rare because I haven't met too many people that have had such bad eyelash loss, but because I did treat exactly over my eyelids, my eyelashes did not respond well, which it's hard to know why that is because the settings for IPL for dry eye is not supposed to really negatively affect the lash or the follicle, but I think it was just, I didn't know that was what was happening. I thought my lashes were responding poorly to dry eye, but then I realized after certain treatments, like, oh no, actually, like chunks are falling out after this treatment. So I kind of finally figured it out. That was probably like my 8th or 9th IPL, but I still felt like I needed to get them for my symptoms, and maybe it was a mix. Like the dry eye also causes my lashes to be more frail or something. And then over time, I started to experiment with other treatments. So I did try radio frequency for like the actual clogged glands, which is like a heated eye wand that they put over your eyes for like, I would say 2 to 4 minutes each lid, with like ultrasound gel. It actually just feels very soothing. It's also anti-aging. I will do that again. I just won't do it with corneal shields in because I felt like the shields were like rubbing my cornea kind of like in the corners. But I had really great oil come out from that.
Is that the one where it helps with muscle contraction and so it will help with your actual lids becoming, I don't know, your blink becoming stronger? Let's say, for instance, I don't have a full closure. Is that what this can help with as well?
So that overlaps with, but radio frequency by itself is actually just the heated eye wand. But then the
Hmm.
Optilift that you're thinking about from Luminous
Yep.
has radio frequency and
The contraction.
yeah, the contraction, what's it called? Like the things that, like the same contraction that a TENS unit does, the EC, like that was a bit different when I tried that for like a training recently. That was like around my eye where they like stimulated the muscles to like, to
Hmm.
help you lift over time to help with incomplete lid closure. So I've tried both types, but the type that I was referring to was just the heated wand that they often pair with IPL now. You'll see a lot of dry eye doctors do like radio frequency and IPL and then expression. That's
Hmm.
like a common treatment now. And I did like that. I guess I got to the point where I started to experiment because I know I need to do upkeep treatments a few times a year. And I expect to flare after a treatment, so I try to time it when I need it, and also when I don't have something important or like I have the emotional capacity to go through a flare because I usually do. But then it gets better usually a bit after the flare.
At this point, you're seeing multiple doctors, not just one doctor,
Yeah,
just for,
I did
yeah.
see a couple doctors also because okay, so sorry, sometimes it's like all jumbled together, but
That's okay.
um yeah, so
It's a
when I
journey.
also yeah, exactly. So when I got pregnant, a lot of doctors won't see you when you're pregnant for dry eye.
Right,
Or like they
right.
won't they can't do much. And when I was pregnant, I suddenly had ocular allergies too, which I've never had before.
You're
So
like,
I
just
was
add
like
to the mix
I
here.
know. I was like, "Oh my," and
Oh my
then part of
God.
me was like, "Oh, have I had allergies this whole time? Will an allergy drop cure me?" And then no, they just made me more
Exactly.
dry.
Oh,
So a lot of trial and error, and then I did. That was when I started to look for other doctors, just because I felt very uncomfortable when I was pregnant. And I do know some doctors are more conservative than others, and just respecting like that's their choice. But
hmm.
I did know of from this is what's great too from the online communities. A lot of people who got treatments while they were pregnant were from the States, so I knew like doctors were okay with treating. Like there were doctors that would be okay with doing certain things. And that was when I started trying the anti-inflammatory eye drops. First, I tried Restasis. That made me more dry, and I didn't like it. And then I tried Xydra, and that is what I'm still on now. So I've been on Xydra about a year.
Okay. I
Hmm.
used to sell both of those drugs, so I know them well.
Okay, nice. Yeah, I'm so
Yeah,
happy that
yeah.
Xydra is a good help for me.
I'm so happy it's helping you
Hmm.
because,
Thank you.
yeah, yeah. I remember when we launched it, and it's definitely kind of like you said, it's not one size fits all. And I tried Xiidra and it didn't work for me, but I'm
Hmm.
so happy it did for you. And there's a lot
Hmm.
of patients that have had success with it as well. And basically,
Yeah.
for those listening, Xiidra just helps nip the inflammation, that kind of root cause that's happening with dry eye. And
Hmm.
it works quite quickly compared to Restasis. Usually within 2 weeks, you start to see and feel relief and it exponentially gets better over time. So that's great. I'm so happy you were able to tolerate that.
Thanks. Me too.
That's
I would
awesome.
definitely wish if I could say one thing would just be to try different things at the start of your journey. Like I think part of me was in denial. I was like, I'm not going on a drop long term. Like I'm gonna cure this. But then it got to the
Yeah.
point where by 2023, which was the worst year that I ever had for my dry eye, I was just like, I don't care. I'll try something. I didn't try till 2024 because I didn't have benefits and they're expensive. Drops
Hmm.
like without benefits, there's a coupon, but that helps. Also, you'll see in the support groups, like someone will tell their whole story, but just because something worked for someone else or didn't work doesn't mean that you shouldn't try it. Because other people
Hmm.
love Restasis. It was horrible for me. I couldn't even use it once a day. Like my eyes were bloodshot all the time. But someone else will be like, "Oh, Restasis helped me so much." So like you have to try, and unfortunately that's the hard part because you might flare when you're trying something too.
I know. It
Hmm.
is, it's such a hit or miss. And, I've people ask me like, well, what should I try or what should I do? And I'm always like, first of all, go and see an eye doctor that specializes in dry eye. I think that's,
Hmm.
a big learning from your journey too, is not every ophthalmologist or optometrist treats dry eye or wants to
Hmm.
treat dry eye or understands it the same way. So if you can find a specialist that specializes in dry eye, that's key. And then from there, what they could offer in office. Not everyone offers the same treatments. And it can get expensive. We've talked about that too. I was watching one of the Dry Eye Foundation patient support group
Hmm.
panels, and they were talking about, the cost of dry eye on the patient is so expensive. So being experimental is hard too because it
Yeah.
comes with such a huge price tag.
Hmm.
So I think that's a conversation we really haven't talked a lot about. And it's an important one to have because, the support for dry eye, even as coverage, like from ODB, there's no way.
Hmm.
We're in Ontario, so that's the provincial drug plan. There's no way. But
Yeah.
even private payers for actual treatments, it's a challenge to get
Hmm.
those necessary. Some will do it, which is great, but
Yeah.
every, insurance policy has different tiers and all of that kind of stuff. So you have to navigate your own health policies as well to see if they'll cover it. And usually, will they cover all of it? It all looks differently, right? Especially with eye care health. It's only like some are like $200 every 2 years for your eye care health.
Hmm. No, I know.
That's not
And
even to get your nose exam.
like I've never had anything covered treatment wise. So like every time I
Hmm.
got an IPL, it was at least it was over $300. So it's like if I did multiple of those, and then also like buying eye drops and buying the eyelid hygiene products and trial and erroring those, and then just to backtrack a bit, before I got pregnant, the year before, I did try a bit of a more controversial treatment, meibomian gland probing. Um, Created by Dr. Maskin, where like little needles essentially are used like up close to your eye with the magnifying lens to break through scar tissue in your glands. But I was terrified to do it. Like I researched it for a year because I'm like, who wants needles near their eyes when they already have like chronic pain in their
Yeah.
eyes?
But you're like, I'll do anything at this point.
Yeah,
That's where
at
we're
that
at.
point, yeah, and so at that point with my doctor, he didn't think I needed it, but I kind of said like if and he wasn't really doing it at the time. I was waiting for the offices to open back up to that procedure, but I kind of just communicated like I trust you a lot because you've helped me and you're my doctor, but if you're not going to be offering it, like I might look elsewhere because I just feel like I'm at my wit's end and some people claim like this has been like life changing for them. And my case was really interesting because it actually didn't hurt as much for me as IPL, like which is like interesting. And all they used was like a numbing drop and numbing cream. And I had a
Hmm.
lot of scar tissue, so my case would be called occult scarring. Like there wasn't signs I had scar tissue from looking at me, but when we did the actual procedure, it popped a lot, so it indicates like there is likely a lot of scar tissue that needed to be broken through. So that was informative, and I will do that again. It's just that was like $2,000 plus at one time.
So how long did that take? And then how long did you have relief after?
Yeah, so when they were doing it, so I think we actually did bottom lids first, and then 2 months later, I did top lids just to
Oh,
spread it
okay.
out a bit. But you can do it
Hmm.
at once if your doctor will do it, but you do have to find doctors that will do it because it is controversial.
Hmm.
Um, I did feel immediate oil coming out when the my glands were being like opened up. And I was actually waiting for a flare to happen because I've read people's stories like they had bruising around their eyes, like their eyes got worse for a while. I had no flare, like I left and looked fine. Like I was like, that's so crazy. And I don't,
Considering the trauma,
yeah,
you're
and
like,
like
this is a
you're
lot
like
of trauma for my
waiting,
life going
yeah,
on right
waiting for
there.
something bad to happen. But I wouldn't say I had like immediate relief from the pain, but I do think my eyes had more oil like immediately. I think just because my corneal nerves were still irritated, that doesn't just go away because there's more oil on your eye. But I do think that procedure helped me more than anything else.
With the probing, did they do warming first? Just, I'm trying to think of how the oil, because oftentimes for those that have meibomian gland dysfunction, for me, it's actually almost like a solid fat. If you think of like a coconut oil
Yeah.
versus what's supposed to be like a nice olive oil. And
Hmm.
so for you, you had on top of what was going on with meibomian glands, but also scar tissue that needed to basically be like probed through. And then you had that olive oil underneath just without warming.
Yeah, I guess that's a good question, actually. I don't think we actually did any warming. I know there's some doctors elsewhere that will, like, once they puncture through, they'll actually put like steroids into the glands to like help with the inflammation in there. I don't think they can offer that in Canada yet. So I don't think I had any warming from what I remember because I was just nervous. I remember I was holding a stress ball, but essentially, yeah, like once you break through the scar tissue, like underneath, there's essentially stuck oil that has the opportunity to flow now from wherever it was stuck, and there's different depths that they'll probe with the needles. It's like 1 millimeter, or yeah, one. I mean, I think it's millimeter. One, 2, and 4. I only did 1 and 2 because 4 is a bit more like deep, and also I think there's um, less consensus on whether people need 4. So I just
Like
stayed a bit
risk
more
reward?
conservative. Yeah.
Yeah, yeah.
Hmm.
Okay. Interesting. You're the first person I've talked to that's had probing,
Mm.
which I'm so intrigued by.
I've helped a few people get it after me who were scared, and they also had good experiences too.
I do love that you're doing patient advocacy as well when it comes
Hmm.
to, your dry eye journey. You've been doing interactions with different Facebook groups, like you said. Can we touch on a little bit of what you're doing in the next couple of weeks as well? You're co-hosting
Yeah.
an event for
Yeah.
patients too.
Yeah, so Dr. Prozia, he's one of the doctors that helped me when I was pregnant. He was just a bit more liberal with help. He's the one that helped me try Zydra. I always call it Zydra, but I think it's Zydra. He took his optometry school in the States, but he has a practice that he works in Hamilton. And we co-created like Dry Eye Support Canada, the Facebook group, because there's like many Facebook groups, but we created like a Canadian community. It's probably about a year ago now that we made the group, and I think we have a few hundred participants online. And we're doing a free webinar Thursday, December 11th at 7 p.m. Eastern Standard Time. With there's like a panel of doctors who are just going to talk about their process for like treating and identifying dry eye, and there's going to be an open panel kind of discussion where people that signed up can ask questions and get maybe some advice on next steps they should take. And then there's so many donations, like a bunch of like companies have donated products and eye drops and things like that. So there's going to be raffle prizes and stuff. So this is our first one. We're going to try to do it every year.
Oh, I love that. That is building community around this is so important. These
Mm-hmm.
conversations are so important. And I know, like, we've talked about this too. Like, you've gone through all of this. Are there any other treatments that you've tried that you want to share? And, I feel like that's an exhaustive list in its own,
Yeah,
right?
no, yeah, for sure. I guess so. I've also had the red light a few times at the office, like with the stronger devices, and then I've had Zest, like where they do the eyelid debridement, which is like the in-office version of like Zocufoam from the company Zocular. I really like getting that as well. I sometimes
Like a
get that
deep
with.
clean.
Yeah,
Yeah.
and even like
Yeah.
if you don't have like obvious blepharitis, we all have potentially like keratinization, or not all of us, but like we all have buildup on our eyelids that could be cleaned. So I find that that's a
Hmm.
good treatment too. And then after I'll talk about my home process that I
Yeah.
do. I do a bunch of things at home, and then I tried the plasma pen, which is like it's kind of like frequency treatment. That was actually pretty uncomfortable because they flip your lids and like kind of feels like it's brushing inside your lids.
Oh,
But I did
interesting.
have a good result from that. But that's again still not really offered by many people, still being researched. But I just feel kind of open to try things. I did like that one as well, and I'm kind of just going with the flow in terms of every, I'd say 3 to 5 months doing some type of treatment in office because I want to prevent it from getting worse, and I know I can't do everything on my own at home.
Where are you at right now from like a relief standpoint?
Yeah, that's a great question. So funny enough, my eyes are a bit more dry in the last week, maybe because of the weather change, like you said,
Yeah.
being in Canada and like the heat coming on in the house. So I do have like my humidifier running beside me. But prior to that, like after going on Zydra, I also moved out of my home that I grew up in, and that seems to help my eyes as well. So I wouldn't underestimate like checking air quality because like we
I
live in a newer
couldn't agree
place now.
more.
Yeah.
Yes, it's a big deal. I think your
Hmm.
air quality is so underrated. You talked about that in the school environment too, which is like, it
Hmm.
makes me think about our kids. And there is this
Yeah.
like influx of, dry eye among kids. I think it's screens, I think it's environment, it's
Yeah.
all the things now, right? But that's a really good point, and it's
Hmm.
such an easy solution.
Mm-hmm.
I don't have it set up right now, but normally I have, a humidifier on my work desk, like small
Mm-hmm.
one,
Mm-hmm.
going just for, especially in the winter. I find
Mm-hmm.
it really helps. It really
Me too.
helps.
Yeah,
Yeah.
I don't have
But
it
it's,
out in the summer. I had a very good summer. Like I have found, like if I'm in the direct sun or in the heat, my eyes do get more dry, but I know that's my rosacea component. Same with when I
mhm.
teach hot yoga. So like I would say on average, like since like adjusting to Xiidra, and I was also terrified of being postpartum because of poor sleep being a trigger. I was scared to be a mom, like with how bad like my pain was in 2023.
That's so sad when you think about it, right? Like
Mm-hmm.
this is supposed to be such an exciting time, and something like dry eye is giving you anxiety around it, which
Yeah.
is heartbreaking, right?
I know, and I'm so grateful that it ended up being like manageable. I think because of the move, because of Xiidra, I think also like all the postpartum hormones and everything that like make you feel kind of like for me, it felt like an adrenaline rush all the time, and just like I can't believe I'm a mom. Like that got me through like waking up all throughout the night and stuff.
She has two beautiful twins, by the way. Two babies.
Oh my god, I know. Yeah, I miss
And
them even though they're out in the hall.
I love that. They're
um,
beautiful.
Thank you. I guess, sorry, this was the long winded answer. I'd say, like, before, like, I go through a flare every now and then, but I'd say on average, I manage my eyes at, like, a 2 to a 3, maybe a 4 out of 10 every day, and I just manage it. But I still notice them. Like, I've never had a day since 2021 where I don't think about my eyes because it's just, like, I feel traumatized from how they've impacted me. But,
Oh,
like, I was 10 out of 10 in 2023. Like, I was scared to go to
wow.
work. I stopped going to yoga completely because the hot room was flaring me all the time. Like I was scared to date because I was like, oh my god, like who wants to date someone that always has pain, and just like there's so many layers to it that
Wow.
isn't talked
Wow.
about.
Well, that's it. And it's a quality of life thing. And
Hmm.
that's exactly what I wanted to chat with you about. It's like how has it impacted your life? And that says it all. Like there were moments in time where, it really stopped you from just living. And
Yeah.
you're not the only one with that story, which is shocking, I think, to some people, but it can get that bad, right?
Hmm.
I'm kind of worried. I had a friend reach out recently. He ended up getting LASIK surgery done, and I'm like, did you get a dry eye workup before?
Yeah.
And he's like, no, but my God, my eyes are so dry, so I just need drops. I'm like, I feel like it's gonna be more than drops. I don't want to freak him
Yeah.
out. And then also just like, more advocacy around making sure that, before we do these procedures, just making sure that we're getting our ocular surface pristine with things like
Yeah.
Sidra, or, making sure that you're doing all the things around making your tear film healthy again, right?
Yeah, definitely. That's like a whole topic because in the online groups, there's like suicides every year from the nerve pain after LASIK, and it's
Yes.
like I think every single patient should do some type of ocular stabilizing, even if they don't have symptoms, even if it looks okay. Like, why not just take precautionary measures? It's not like it is gonna like cause any harm to the doctors or
Yeah.
anything. Like, I think that
Yeah.
should be mandatory.
I couldn't agree more. I think early days, the drug companies were talking about, just do a 3 month stint of Restasis before, or,
Yeah.
Xiidra before, just to
Hmm.
get that ocular surface ready. And if there's any little underlying issues, at least that can help you get there quicker. And then a combination of all the other things. My guess is you're doing a lot from like a dietary perspective. You're very in tune with your health. Are you doing everything from omegas and gut microbiome, all
I
that
could
fun
definitely
stuff?
do better since becoming a mom. I think that's most of that's gone out the window. I always take my omegas, and in the winter my vitamin D, and like if my iron's
Hmm.
low, I take iron.
Hmm.
But I've done a lot of other things, like things for nerve pain, like some supplements or even herbs to help. Like I've taken like I'm trying to think because I've done way less lately, but I've taken like things like quercetin. I know like I've looked at some of the lectures from dry eye doctor trainings and looked at like supplements that are supposed to help nerve pain. Like I've done all those things. I do think I could
Yeah.
definitely work on my gut health, especially being on antibiotics a lot since giving birth.
Oh, yeah.
So like that's I'm actually seeing a naturopath next week to like start like focusing on all the other elements again as well because I know all those things play a factor in our oils and our eyes and everything as well.
100%. I find for me, that's what I'm most passionate around, I think, in this whole journey is, like you, I've had to go on and off antibiotics lately too. It's super frustrating.
Mm-hmm.
And that completely derails my gut microbiome. And I feel
Mm-hmm.
it instantly in my eyes. And so I have this whole protocol that I
Mm-hmm.
follow based on healing my gut, introducing everything from like things that help with digestion from, as simple as, lemon water in the morning and, apple cider vinegar to help with like digestion. And then I'm not so quick to throw a probiotic in there because I feel like you can get a lot of this with your diet if you do like more of a whole foods approach. And when I am consistent with that, my eyes feel so much better, like exponentially better. It's just that like being consistent with the whole gut protocol is hard in real life too,
Yeah.
right? Because there's so many things that will derail us.
Mm-hmm.
Your story is very impactful, and I think, you know, it's incredible to me what you've gone through. It's a lot. It's a
Thank
lot.
you. I know. Like when doctors hear or I tell like the whole list of everything, they're kind of like, "Oh, like your eyes sound like you're like 70 and like went through like a lot of things." And like I know, I'm sure there's like many factors. Like I do remember being aware of my eyes at a young age. Mostly related to like going in stores. Like my eyes would burn when I went shopping with my friends and when I wore makeup. Like growing up, I couldn't wait
Oh
to take my
yeah.
eye makeup off. Um, and I
Interesting.
just wish
So
I knew.
exactly. So it could have
Mhm.
been, it probably started really young for you.
Mhm.
Me, it was the way I was wearing my makeup too. That
Mhm.
was probably the straw.
Yeah, and it's crazy how you have to like adjust everything. Like, I've actually grown okay with not wearing much makeup. Like, I prefer to like do something on my lips now, and like when that way when I wear eye makeup when it's a special occasion, it feels like extra nice. But it
Hmm.
took a long time to accept like, oh, like I used to wear mascara every day. Like that was my main thing.
Sure.
I had really pretty lashes, and like
Yeah.
I have not super pretty lashes anymore. Like they're starting to grow back in, but it's taken like almost 2 years to like almost equal out on
They'll
both sides.
they'll get there. You're going through like all the things, and they'll come back. They'll come back for sure.
One thing at a
Um,
time. I'm just grateful to be out of like that level of pain and be able to enjoy my life. And at one point, I felt like I was getting emotional when you were talking about the support group and just like all those things because I've even made like friendships. Like there's a couple girls that I talk to multiple times a week. That actually one of them is due. Oh my god, I feel like I'm gonna cry because we met in real life too. But she's gonna have her baby in January, and when I was pregnant, she was terrified to get pregnant because our stories are very similar too. Like just like scared to be a mom, scared to be postpartum, scared to go through all those things with that much pain, and also like it's not a condition that people really know about. Like I have arthritis, I have dry eye. Okay, put some eye drops in. Like it's not that simple.
it's not, and
Yeah,
no, you're absolutely right. And it's so wonderful that she has you, and then, something good comes of this, right? In that regard. I always say that, like, look at the gift if you can in these things, and even connecting like with you and, other people. This is like kind of the gift of it, right? And I think something like it's somewhat treated like a rare disease in a sense, right? Like people
yeah.
don't really understand it, but
Mhm.
so many people are affected or will be affected, I think, just
Mhm.
because of modern lifestyle and the way that, we live.
Mhm.
Yeah. Going through all of this and, your expertise, you're a psychotherapist, this is really taxing from a mental health perspective. What are the things that you do or have even helped other people through to get through this?
Yeah. I'd say it's funny when my journey was really hard. I wasn't a therapist yet, but I was doing a lot of. I had gone through a lot of therapy, and I was already really interested and did a lot of like reading about stuff in my own time. So
Hmm.
at some points, it felt like, oh, if I could just think more positive, like maybe my symptoms would go away, and I had to like let that kind of go. Like, oh, I actually have like a physical condition, so like accepting those things and like not trying to like positive vibes it away. That actually
Mm-hmm.
released some of like the weight on me. I mean, I'm still like, I love going in the forest on walks. I find it like really regulating. That's something I miss because there's no forest near me and I don't take the babies in the forest by myself.
There's one by me. Come visit
Okay.
me.
Yeah. Okay, I
Yeah,
will.
I'll
And
take
the babies can
you and the
come.
babies in the forest.
Yeah.
It's not a scary forest. It's close. We can do
Okay, I
that.
would love that. Yeah. What else? Like, I still move all the time. Like, I still like weightlifting.
That's
I love
key.
swimming in my
It's
parents' pool, like doing things like with
hmm
people that I love, like especially through the hard times. Like, I know there's a lot of talk about like balancing your nervous system and that kind of thing, but it's really hard when you're in chronic fight or flight because you're in pain to like feel relaxed. So like
hmm
just doing the best that you can and like utilizing the tools that you have available to you and finding like what are those tools for me, like maybe for someone else it's dancing, or like I like dancing too. That's not my main thing. My point is just finding the things that make you feel connected to yourself and ground you to get you through like the really hard times.
Yeah, well said. And it's so true. You kind of have to find your joy, right? Like,
Mhm.
what are the things that light you up? What are the things that, it's almost a distraction, but
Mhm.
it's a healthy distraction.
Yeah.
Um, I think that that's such a good message for sure. For
We
sure.
actually talk about that too. Like, not sometimes distraction gets such a negative connotation, but it's like sometimes we actually need to distract ourselves. Like, if we're ruminating or in like a downward spiral, like distraction is actually a great tool. It's not necessarily a negative thing.
That's really good advice. Makes me feel less, you know, um, what's the word? I feel seen. I feel
No,
seen because I don't
good.
want to be like an escape artist.
Hmm.
That's not the goal. Yeah, yeah.
Hmm. Yeah,
No, I love
totally.
that. One of the last things I'd love to get your perspective on
Hmm.
is any advice for someone, A, that may not have dry eye, but also at the beginning journey of their dry eye. You've gone
Yeah.
through a lot, and I think you have some pretty incredible insights and advice.
Thank you. I actually have some people in my life that are at the beginning of dry eye sometimes, and it might sound like I'm hounding them, but I'm just like, I know how bad it can get, so like, just do the things now.
I
Um,
love that.
yeah, I think the first thing that comes to mind is like if you're always reaching for eye drops, like you have to go do something else because with the eye doctor, because eye drops are just a band-aid and they might be helping you now, but like dry eye disease is a disease because it's progressive and we don't have a cure. We just have treatments right now to help quality of life and to help slow how fast it like develops or gets worse. So just like finding a dry eye specialist, your regular optometrist might, or even your regular eye doctor might not have enough insight. So like keep researching and keep finding options until you find someone that you feel seen by and validated by. Yeah, and I would say just don't put it off. It's one of those things where it's like, oh, that's another thing I have to book. Just get your eyes assessed. Honestly, I hope one day that this is just included in eye exams. Like every person's tested for it, um, especially with kids and screen time now and stuff.
I couldn't agree more. I think
Hmm.
like these discussions, more advocacy around it, we're seeing more and more, spotlight being put on it. So I think that that's a really important point is to, have this part of a regular eye exam for sure.
Hmm.
And I think we're getting there. And I think that it's really important. Those messages are so important. It's like anything. Catch anything at an earlier stage and you're not going to end up in a situation where you feel hopeless. And
Yeah.
so that's the goal, is to raise awareness, treat early, and take it seriously, because
Hmm.
it does sound very vague, like dry eye, but it can be quite serious, to your point.
Yeah.
So
Then the next thing I would say is like if you find out or you do have it, like treating all your comorbidities. So like some people might have allergies, some people's eyes might not close at night. Like I always sleep with a silk mask. It's not like a crazy weight on my eyes, but I do notice if my mask falls off in the night, my eyes are more dry. Um, like if you have allergies, treat them.
yeah.
If you have ocular rosacea, that might be a different treatment than someone who only has clogged glands. Like treating all the angles of it to help all the angles that could be affecting you, because it's not just you do one thing and then it's like fixed.
No, no, that's really a good point. I think for me too, I'm guilty of not always doing all the things. And it's hard when you're like, I already have to stack it on top of all these other things, but I'm gonna wear a night mask tonight because it's been a minute and I need to do that because I always feel better in the morning when I do that. And I forgot about that. it's those things too. And it's staying in a community. And you and I go back and forth all the time, and, staying in touch with people that are here to help and want to help, I feel like is really important as well.
Yeah,
Yeah.
that's the
No,
gift
you're
that you
doing
were
great
saying.
work. And I'm so grateful to have met you. We met through Dry Eye, which is, what we
Yeah,
were just saying was the gift. And I really do. I really am so fond of you and everything that you do,
you're
and
so sweet.
our new friendship that's grown out of Dry Eye. I
Me
mean,
too.
it's pretty special. So
You are
I
so kind.
appreciate this conversation, of course, and anything that I can do to help, I will do whatever I can. I know that you're doing great work too. I'm excited for your webinar. If there's any final thoughts, I'd love for you to address the audience just with your wisdom, and again, we're so grateful.
Thank you. And I, first of all, again, I want to say thank you for how kind you were from when I first reached out to you. It was actually from like someone from yoga that mentioned you, and then I found your Instagram, and then we connected from there. And yeah, just with your
Yeah,
help and everything and insight, I'm grateful for the
happy
gift,
to.
like you were saying too. I think another, like we were saying, addressing all the pieces, just like finding a home routine that works for you, like because the things you do at home also make an impact. So like I do my like the hydrochloric acid spray 2 to 3 times a day, like, and then I do. I have to have a fine line with heat, so like I do use a wand on my eyelids like every 2 nights. If I'm in a flare, I skip it. I do cold
Mm,
compresses, and then Zydra, and then now that it's dry season, I am using lubricating drops. But at one point, I wasn't even using lubricating drops because everything else was doing pretty well. So just
hmm.
finding the commitment within yourself to do the things at home, because that does also space out how often you might need a treatment from a doctor. But it took me 4 years to find my sweet spot with my home treatment. So being patient with yourself and the trial and error, and yeah, just not letting it consume you, because it can consume you if it gets to the point where you're in daily chronic pain, which I'm sure there will be some people that listen to this episode that maybe just have some symptoms and it's not as debilitating, and then maybe some people this reaches are like me where like they don't see hope at all anywhere. And I just want to say that there is hope, but you have to keep putting yourself out there, like asking for referrals, sometimes paying out of pocket. Like by now they're like thousands of dollars, but like there's nothing that's worth more than our health, right? So I guess that's what I
Absolutely.
would
Yeah.
finalize.
Yeah, no, I appreciate that. That's really good advice. And I think that it's really important that people recognize that we are in this together, and there's support and there's hope. And that's a really good message. So, again, thank you for that. And thank you for all of this time. I know it's been really tricky to nail it down. So, I'm so grateful that you had this chance to join me tonight. And I'm, again, grateful. I know someone in the audience has definitely resonated with this. So that's the whole point. And again, I appreciate you so much.
Yeah.
Okay,
Thank
amazing.
you for having
Thank
me.
you. Thanks for tuning in to Dry Eye Girlfriend, where beauty, wellness, and science come together to support your eyes and your life. If today's episode helped you feel seen, gave you that aha moment, or just made you feel a little more understood, share it with a friend, subscribe, and leave a review. It helps more women find this space and feel less alone on their dry eye journey. Remember, dry eye isn't just something to deal with, it's something you can manage with the right support, smart choices, and a little girlfriend guidance. I'll be back soon with more real talk, expert tips, and conversations that keep your eyes and spirit feeling bright. See you next time.